Hi everyone! How many of you have left your doctor's office feeling frustrated because you waited for so long, your visit was too short, or didn't even feel like you were well assessed by your doctor? This poorly coordinated care can lead to an increased amount of patients to pass on a trip to the doctors. I am unfortunately beginning to be one of those people. I would like to share my story with you that has changed my views on the quality of patient experience. It was about 4 years ago I decided to go to the hospital because I was having flu-like symptoms. I went through the typical long wait, saw my doctor no more than roughly 8 minutes, got a prescription of ibuprofen, and that was it. During my talk with the doctor, I'd explained how I've been having a stiff neck for the past few days and was having extreme difficulty swallowing solid foods. My doctor responded, "You must have slept on the wrong side for too long and you should stick to soup for a while." I was appalled and disappointed to have a professional doctor not take my symptoms seriously. A couple days passed, and during the time I was taking the ibuprofen, my symptoms became worse. I was experiencing the side effects of heartburn, dizziness, and headaches, along with my flu-like symptoms. My parents and I made the decision to go to the emergency room one night because what I was feeling felt unbearable. Long story short, I found out that I was misdiagnosed and that I had viral meningitis. I was surprised because the doctor said the stiff neck should have tipped off your diagnosis. A patient can have a positive outcome, but a negative patient experience. How common is a misdiagnosis in the medical field? Why does it keep happening? Is there anything being done about this issue? Patient experience and patient satisfaction is important because it measures the quality in healthcare. If patient satisfaction is not met, that means quality in patient experience was low. The problem with doctors rushing through patient after patient heightens the lack of focus and quality care. According to the Health Leaders Media Industry, patient experience and satisfaction is the number one priority for healthcare executives above clinical quality, cost reduction, and many other burning issues. A misdiagnosis and other medical errors are the result of hospitals not having an efficient plan. Doctors, nurses, and other physicians fail to empathize, invest more time, and preserve dignity. Based on my personal experience and my research, these three characteristics brought me to the conclusion of why this is a problem of why medical errors occur. These weaknesses contribute to why patients will revisit the hospital and continue to feel ill. Patient satisfaction is limited because patients will focus more on patient surveys, on physician agendas, and not on the patient themselves. Throughout my research process, I started to think of possible and reasonable solutions that can help improve the quality of patient experience. A solution I would propose is to create a proactive care plan for doctors and nurses to execute with patients created by the hospital administration. An additional solution I would like to add is for hospital administrators to conduct monthly trainings for doctors and nurses as refreshers to keep knowledge revived. A proactive plan should consist of expressing courtesy and empathy, listen and understand, inform and explain, and be quick to respond. Doctors need to put themselves in the patient's shoes and create a personal relationship that shows compassion. Patients expect their doctors to keep up the timings, behave properly, and communicate well. They also expect concern, care, and courtesy. The idea of a proactive plan can be incorporated to the monthly trainings to constantly raise the quality of patient experience. Weaving these two solutions can help better patient wait time and decrease the number of patient revisits to the hospital. Solutions like this can slowly create a domino effect by complementing other issues and slowly diminishing them over time. Patient satisfaction is an attitude. Though it does not ensure that the patient will remain loyal to the doctor or the hospital, it is still a strong motivating factor. Patient satisfaction is only an indirect indicator of the quality of the doctor or hospital performance. Delivery of patient-focused care requires that hospital administrations provide care in a particular way, not just sometimes or usually, but always. It must be every patient, every time.